It just takes a moment. Okay, and you are officially live.
Thanks, Penny. Good afternoon, everyone. Welcome to the Health Equity and Access Response Team of DuPage County. I'm Dave Roth, and I'm going to talk a little bit about what we'll be doing today. I do want to give a heads up to those who are with us today for the first time. We're going to ask you to take a minute in a couple of minutes to introduce yourselves. Tell us your name and your affiliation and why participating in this group is important to you. So we'll do that right after I do a couple of ground rules. First, I want to remind everybody that this is a live streamed meeting, live streamed to the public, and it is being recorded. So it'll be posted on the YouTube site of the health department so that it will be available to others. And I'm noticing on that YouTube page that 30 to 40 people are reviewing this meeting. So I encourage you to encourage others to spread the word about the work we're doing and give them access to us through that recording. So you know that this is visible to the public. You know it's being recorded. We ask that you mask background noises. So if you're not presenting or talking, that you keep your microphone muted. I thank you very much for that. So we have a very full agenda today. It's also very important that we close this meeting at 3 o'clock. So we've done some adjusting in the way that we do the agenda. So those of you who have been here before, this will feel a little bit different. It's an adjustment. It's an experiment. We'll see how it goes. So here are the things that we're going to accomplish today. We're going to welcome new members to the group and ask them to introduce themselves. We're going to spend some time focusing on equitable vaccine access for some specialized populations. We're going to do the thing we promised at our last meeting, and that is take a look at COVID-19 vaccine education and access for essential workers. That's going to be an important conversation for us. Then the DuPage County Health Department COVID-19 vaccination update will come. We will close with a communications subcommittee update, and I want to highlight a couple of things for you there. You remember at our last meeting, we looked at preliminary results of our vaccine confidence survey. Fascinating feedback that we got from some 4,000 folks in the area. That survey has been briefed in some detail with the subcommittee of communications. So we're not going to give it a lot of attention here today, but we do want to note that that work is continuing. Also, that subcommittee is debriefed with Sarah Phelan and with Reverend Miguel Briones about their events. You'll remember that we promised that we would hear from them at this meeting about their experience of those community vaccine events. So I hope that in that communications report, Mila, if it's possible, that they would get a minute to recap what they shared with the communications subcommittee. So that's the way that we'll move through today. So let's begin this with introduction. So I want to invite those of you, oh, you know what? I have one more thing I'm going to request of folks, especially if you're here the first time, you haven't heard me say this before. This is a team of people. Most of us did not know most of us the first time we came together in October. And so we've striven to keep our cameras on so that we can build relationships as we move together. So I do want to encourage you that if you are able today, and certainly some people will not be able to for circumstances, but if you're able to leave your video active during the time that we're having group activity, that'll help us get to know each other better and build the long-term trusting relationships that we need to succeed at this work. Thanks. So let's begin. I want to invite those of you who are on the call for the first time, please introduce yourselves, tell us your name, your affiliation, and why this activity of health equity is important to you. I could pick out folks because I'm seeing some new faces, but it would be best for me if you just self-selected. Cristobal, go ahead.
Yeah, it's really a pleasure to be here. We see a lot of dear brothers and sisters on here, all, and we thank you so much for the invite. I'm Cristobal with the group Immigrant Society DuPage. Our mission is to educate, organize, and mobilize DuPage County around the rights, culture, and collective struggles of the Latino community. We operate the Casa DuPage Worker Center here in downtown Wheaton. We started in 2007 in the Latino neighborhood in Glendale Heights. Our 3 points: culture, community, and struggle, culture, and community. And in that, the past year, we've met a lot of you guys and on this road, struggling against COVID, doing food pantries, struggling against contaminated companies, struggling against landlords. So it's really an honor to be here with such a wonderful group of brothers and sisters this afternoon. And thank you so much for inviting us. I look forward to taking part.
Cristobal, welcome. We're glad you're here. Other newcomers?
Hi, everyone. I'm Amanda Kelly. I'm with the American Heart Association. We have an AHA representative on these calls already, Phil Giapoco. He is transitioning into a new role with the American Heart Association, so we'll be transitioning off of this work group, and I am happy to step into that place for him. You know, at the Heart Association, we are very committed to the work around COVID and the vaccine, within all these spaces as members of the larger Ad Council campaign, as well as our own promotions, as we understand and see the effects that pre-existing conditions have on folks, as well as the after effects COVID has had on individuals' heart health. So nice to meet you all and happy to be here.
Welcome, Amanda. Other newcomers?
Hi, David. It's Thea. I can go next.
Hi, Thea.
Hi. Hi, I'm Thea. I'm with Access Community Health Network. We are a network of community health centers in the Chicago area, including Cook and DuPage counties. We have 3 federally qualified health centers in DuPage County and have been responding to the COVID pandemic. It's, you know, part of our mission to make sure that we're reaching those that might not otherwise have access to care, and have been providing COVID testing and now COVID vaccines, making sure we're reaching hard to reach communities. So happy to be here.
Thea, thank you. It's good to have you here. To those who are just joining us now, we've just begun the meeting. We're doing some introductions. In order to be efficient with our time, we're introducing folks who are new to the group today. So if you're arriving into the call and you are new, I encourage you to step forward now and let us know your name and your affiliation and why this group is important to you. All righty, folks, nobody gets forced to do this work. So we'll give one last shout out for those who want to come forward and introduce. I'll bet, Gabi, I bet you do. Do you mind?
Yes, good morning.
Good.
My name is, thank you, David, nice to see you. Good morning, everybody. My name is Gabriela, whatever, Hernandez Chico. I am member in Immigrant Solidarity DuPage. It's really very important this because, you know, this is my community impact more in this pandemic time. Thank you.
All right, thank you very much.
Thank you.
Well, thanks all. It's great to have new members with us today. Thanks. We appreciate your participation with us. And I'm going to move us to item number 2, which is about our growth and next steps as an organization. And actually, the best way for me to begin that process is to say to all of you, thank you. I know through your participation with this group and through all the other things I see happening throughout the community, that you have been incredibly hard workers, responding to incredible changes and doing this at a time where in your own lives, personal and work related, you're experiencing tremendous loss. And I want to honor and appreciate and thank you for all the work that you've done in the community, in your lives, and with this collaboration here. We came together last October, and excuse me, that was my phone going off. And at that time we had a charter and we had a membership invitation list, and we just dove in. And we've been covering an awful lot of ground in reviewing data, disaggregated by race and ethnicity, thinking about how we put that to work in the community. We've been dealing with data every time we've come together and what it means for us in a community. We have looked at the prevention work and the protective work. And then when vaccine came along, we've been giving that a great deal of focus. And we've been learning as we go. And we launched in an emergency mode. It's like a plane taking off, but we were building the plane as we were moving in the air. Now we haven't left the emergency response phase in our community, but many parts of our community are beginning recovery efforts. So we also, at this point in our life as a team, want to sit down for just a minute, put the plane on the ground at our next meeting, and kind of check our fuel gauge, check how the building is coming, and make sure we've got a chart for the future that's going to carry us the long distance that we want to go. So next meeting, we're going to do some relooking at our charter, at our membership, at our commitments to each other. In between this meeting and the next meeting, we'll give you a brief survey and ask you to give us some feedback about what's working, what's bringing value to you and your work in the community, what's not, and some of your thoughts about what's on the horizon and what we should be focusing on. So please keep an eye out for that. It won't be long. It won't be difficult for you to fill out, and it'll be enormously helpful to us. So that expect that to come our way. Unless any of my colleagues in leadership have anything they want to offer in this section to add to that, we'll move on to agenda item number 3. All righty. I'd like to bring to the microphone Kara to talk about equitable vaccine access for special populations.
Good afternoon, everybody. Happy Friday. You know, we have, this topic is really born out of a recognition, I think not surprising to anyone on this call, that our focus and the scope of our efforts is both large, significantly sized populations within our community, and also potentially smaller populations that have a lot of barriers to accessing vaccine and equitable vaccine distribution. And we tend to talk about health equity from a lens of race and ethnicity, and not inappropriately so. But there are other lenses and there are other populations that without some explicit focus are at risk of being left behind in our vaccination efforts. So I wanted to just spend a little bit of time learning from subject matter experts in the room, brainstorming to the extent that we are able, and also when we can, sharing some of the plans that are already underway for what I am terming special populations, certainly not an official term. I also want to really invite people to help us to identify other populations that aren't on this list but need to be, because I think that it's sort of incumbent upon all of us to really be casting a net broadly and thinking about who is potentially left behind through our efforts. It's no one's intention, and nonetheless, without some really explicit focus, it may be an unintended consequence. So part of this has come about through some conversations we've had about around, I don't know if everybody, I know everyone received the agenda, but I don't presume that everyone has it in front of them as we sit and look at each other on the screen. So I will rattle off the special populations that we have listed on the agenda, and then we'll take some time after we talk through some of those to really invite people to offer up others that we should be considering as well. One population that I think a number of us have been working on trying to make certain are being kept front and center is the homeless population here in DuPage County. because it's highly probable that some of the systems that work for most will not work for them. And so we need to think creatively both about the manner by which we offer and encourage vaccination, and the locations that are going to be best positioned to deliver vaccine for individuals who have unstable housing. Another special population that I'm hoping Amanda and others might be able to talk to us a little bit about is outreach, not just to immigrant populations, but specifically to refugee populations, who are in some cases relatively small numbers of individuals from their country of origin, who may be linguistically isolated because there aren't a significant number of people in the community who speak the language of their preference, and who may have some fairly substantial barriers, both in terms of accessing vaccine and also around their confidence around the choice to get one. I also want to talk a little bit about the homebound, which is actually a larger population than some might expect, but individuals who either for lack of transportation or because they literally can't leave their home because of physical limitations, need to be able to have vaccine come to them. And so we need to be ensuring that we as a community are addressing that. I know a number of folks have been working on it. It's actually a fairly complex issue because it is so labor intensive on an individual case basis. We also want to talk a little bit about navigating clients with mental illness and substance use disorder. There's a little bit of vagueness, and it's going to matter less as time goes on and the accessibility to vaccine increases, and also the eligibility criteria become ever broader. But many would consider serious mental illness or substance use disorder a disabling condition, but they are not explicitly named in the guidelines around who qualifies for vaccine. The other truth is that many individuals living with long-term chronic serious mental illness or substance use disorder have a number of other health conditions that also greatly increase their risk of poor outcomes should they contract COVID-19. So, and this is also a population that for some of them is highly vaccine resistant or hesitant. Imagine, for example, someone who has paranoia as a feature of their serious mental illness that is not adequately controlled by medication, trying to decide whether or not this government provided vaccine is something that is safe and comfortable for them. And how do we help to afford people all of the information they need respectfully so that they can make those decisions for themselves. The last group that I have actually been thinking about as of late is what I'm going to define from a vaccine perspective as mixed status families. And these are individuals not in mixed status as we typically think of it, which often has to do with immigration, but rather individuals who have some family members who are vaccine hesitant and others who are confident. I got a call today from someone who was advocating on behalf of a 16-year-old who very much wanted vaccine, but whose parents were not supportive of that decision. And I have a feeling that as time goes on, we will have court cases that speak to how this space gets navigated, but it may be a place where we want to have some conversation down the road as well. So those are the populations that are in my mind. I wonder if others have special populations that they think we should be adding to this list, and then we can go through at least a few of them and talk about the strategies that exist now. What are we missing? What other high barrier community groups do we need to be paying special attention to and ensure are on our radar and we're planning thoughtfully around?
Kara, this is Rashmi. I just wanted to ask, can you please recap again? I know it was homeless, and then was it caregivers?
Homeless, homebound, two different
Homebound,
groups,
yes.
of course. Refugees, clients with mental illness and substance use disorder, and then I added youth. Caregivers are certainly a population that can really be challenged, because if they are full-time caregivers, it can be hard for them to take care of themselves and get out to be able to get a vaccine. So I did not have them on the list. Maybe they should be.
Well, and maybe incorporating them in the circle of homebound individuals as relevant. But sorry, I misheard if it was a separate one or not. But no, that sounds good. Thank you for the recap.
Kara, this is Karen, and kind of to that same kind of lens, childcare workers. I know when we've in the past done flu vaccines because of the extended days, and I'm not only talking about center-based childcare workers, but a lot of people who do it in their homes, I think, too, have challenges accessing healthcare in general, but specifically vaccine.
There's some overlap, I expect, Karen, when we talk about essential workers a little bit later today, individuals whose shift work makes the timing of most vaccination opportunities problematic. And I think you're sort of describing a similar circumstance. In their case, you're absolutely right. They could be starting at 6 a.m. and going until 7 p.m. If they're working alongside the work schedules of the different families that are using them as child care providers. So that's a great example. Any others?
Sarah, this is
Jana,
Thea.
you're Thea, and I think Jan, you after Thea, because I saw
Okay.
you unmuting.
Okay.
I was just, and there's probably overlap in categories too, but I'm also just thinking about people with disabilities that might be included in Homebound and some of the other categories you listed, but might be good to call those out as well.
Absolutely. Jan.
Okay, I'm doing this from my iPad, and this is the first time I've done this. Okay. We had talked about in a previous meeting, the significant number of undocumented immigrants in this community. How do we reach them?
So in my mind, I think that number is so significant that I actually put it into our other efforts. And so my failure to call that out is not about a lack of focus, but rather that I bundle that with so much of the work that we're doing with the Latinx population. Certainly many of those folks with whom we're working who are Latinx are not undocumented, but that I include them in that group. And we can certainly talk more about what's happening now and what should and could happen to make that process lower barrier as well. Reverend,
unless we have significant numbers to suggest that undocumented people are predominantly Latinx people, we have to be careful, I think. Okay.
I am going to say my
Yes.
program serves almost exclusively undocumented people. Literally, that is who we serve. 97% of those individuals who are enrolled in Access DuPage speak Spanish as a first language. They are not all coming. They are coming from different countries. I want to be very clear, but most of them are coming from communities south of the United States.
Mm-hmm.
But there are certainly other populations as well.
Absolutely. And this is Karen. And just to reinforce what Jan was saying, I've become aware of a significant number of Chinese refugees from China, and some of the more Indian, Pakistan, and so I think absolutely when we talk about undocumented, primarily we're talking about Latinx, but I think we have, as a melting pot in DuPage, quite a few other parts of the world that we need to continue to reach out and focus on. So thank you.
Dr. Asfar, you mentioned the Sudanese in the chat. Is that in reference to the documentation status of some of those who are coming from Sudan, or a special population that we need to? Can you tell us a little bit more about the barriers and challenges that you see that we need to be sensitive to in regards to the Sudanese?
Yes. So I reached out to refugee Sudanese population, and I spoke to a couple of leaders, and they themselves were not comfortable for getting the vaccine. And they were very hesitant. So I feel that all the social media posts, nothing is working in that population. They're extremely hesitant. We have to reach out to them, talk to them and discuss this. So it needs more efforts. And then there is another important thing is Ramadan is coming. And if you remember last year, due to COVID, all mosques were closed. And this was the first time in the history that no Muslim went to mosque to pray, to offer the prayers. These are special prayers, all 5 times, and then added in the night, we pray till midnight. And hundreds of people go in the mosque. So this time, all mosques are open. There will be socially distanced, congregations, but we have to offer vaccines to the mosque and plan properly for that. We have 8 to 10 mosques in DuPage County area. So, again, this is the time how to build confidence and how they can open their doors to us. One mosque has opened their doors, and hopefully Mila and I will be talking to you, Kara, on that soon.
I am actually aware of 3 mosques who have expressed an interest and a wish to have vaccine events of their own, and similarly to offer vaccine to other community partners, not to serve exclusively their population, but rather to be a hub from which vaccine might be offered. So I appreciate the generosity of that. Amanda, can I impose on you to talk a little bit? We were speaking about the Sudanese, but I know that there are a number of populations that World Relief is working with very closely. And I wonder if you could share your perspective on vaccine confidence within the refugees communities that you're serving.
Yeah, sure. And I invited Jen to join me in this meeting because I know she is working a lot with in the effort to get people connected and get resources. And so Jen, feel free to jump in at any time. But yeah, we're seeing a lot of mixed feelings. So there's some communities who are very much for and want and are very anxious and excited to get a vaccine. Other communities, lots of fears and misinformation. And so we're working among all of the refugee populations that we have resettled over the last how many years. Within each community, we will be trying to reach out and just do what we can. We've already done a lot, but Jen can speak a little bit of this too, but we did recently bring on a Sudanese community health worker and a Congolese community health worker to work specifically within those 2 communities, both in the Aurora and the DuPage locations. And so they're going to be really trying to help to get information and build confidence. And because those are the 2 populations that we saw having the most fear, the most hesitancy. So we just want to make sure that we get out to those communities the information. Oh.
And I was going to add on to that, our Sudanese health worker is also an Arabic speaker. So we're hoping for her to also reach out to our Syrians and Iraqis in both offices, particularly with Ramadan coming up and lots of questions around that.
That's great news. Before I go any further, Reverend Briones, it occurs to me, you were trying to speak earlier and in the melee, I forgot to come back to you. I wanted to make
this is fine, Kara. Thank you. I want to say first the thank you for the whether your respondents, especially the Latino community, and understand that the needs and barriers that they have. I mentioned on a list many situations that as Latino they face and unable to get the vaccine. Say thank you too, because I get on the phone calls from people who's having a text message from Access the Page, to invite them to get the vaccine. This is wonderful, but there's still some many questions, about if I'm qualified or not. Something what I realized in the Latino community is that the average age, they are not too old, they are probably 35 to 45 or 50 age. So, and this is there could be, a big question for the people, I'm able to get a vaccine or not, So this is one more thing we need to keep in mind to how can we answer or face this situation. I know you haven't done a great job, but things like this is coming up, we're learning in the way. So yeah, but just want to mention this and this. And welcome, Cristobal. I'd like to see you here, working out with the Latino community.
Adelante. Good to see you. Good to see you, Padre.
Gracias.
It is very easy to see why people might be confused about their eligibility, because even for those who are working very close to this issue, it's an evolving topic, right? So from one week to the next, those who qualify it's constantly growing. That's the good news. But people are not always clear where we are in those stages, and they've certainly shifted over time. Reverend Briones, it goes without saying a couple of things. One, we will put together in Spanish some social media posts that can be shared that highlight very specifically who qualifies today, and try to make that easy. But the other piece is that within a few days, honestly, by governor guidelines, that will be almost immaterial. And in some ways, it will be easier when that is the case. Not that it won't create challenges around demand, but because people won't have to worry. If they are over, say, the age of 16, they will effectively qualify for a vaccine. They may still not be the priority. There may be some who are continuing to focus on a priority population that is deemed to be slightly higher risk, but not to suggest that they don't actually qualify. I wonder if we could talk a little bit about efforts around the homeless. And Mary, I can talk about it, but if you feel comfortable doing so, would love your perspective on what you're sort of hearing from within the homeless continuum of care, and also some of the efforts that are underway to create resources in that space.
Sure. Well, the largest provider currently of emergency shelters is DuPage PADS, and so PADS has been working. Adam might need to chime in on this, but DuPage PADS has been communicating with the health department to sort of first and foremost, they needed to communicate to folks who were eligible, which wasn't necessarily a lot of their clients. Now that it's opened up, they're certainly doing outreach to make sure that people are registered. They were assisting people to get registered with the health department. And I think in the not too distant future, I'm hoping that there might be an opportunity for a mobile vaccination to go to the DuPage PADS is providing rooms in 3 different hotels in the county. And so the folks who have transportation and have are willing to access vaccine, I think PADS will make sure that they understand that they're eligible now. But the folks who can't access it, I think we'll be looking for some sort of maybe a mobile clinic. I don't know if Adam has any more to add on any conversations he's had with PADS.
Sure. Yeah. Well, Andrea Gargani with our team has actually been really running point on that, but I know she, we kind of stand ready to kind of go some places and start doing those groups now. It will certainly be more efficient for us once we get our mobile unit completely outfitted and ready to go, and that is literally like a Sprinter van that we will outfit and be able to go over to groups like that. We're expecting to get that at the end of this month, and we'll be able to do probably again bigger groups at that point. But right now we're able to get out there and do a little bit of smaller volumes now, and it's just I really think the only gap I understand there is just matching up the logistics at this point, kind of matching the dates, times, locations, making sure the the clients are ready, willing, and just kind of lining all that up. But we're ready to launch that.
She's not here yet. I know she's planning on joining this meeting, but thought she was going to be a few minutes late. But I also want to give a shout out to VNA, who has offered up their willingness and is working with PADS right now on setting up mobile events at any of the sites that they wish. And also the same for Catholic Charities, for Metropolitan Family Services, for 360 Youth, and for did I catch all of them? I may have. I don't think Bridge was involved in that conversation, but that may ultimately prove to be a place where we want to have some discussion as well. So between the efforts of Andrea and the health department and the folks at VNA, and then the ability for some of the families that we're talking about to indeed get to an event, especially one that's close to where they are typically staying, I think that we are well on our way to having adequacy of resources in that space. I think, however, that the issue of confidence is one that is going to continue to need a lot of work. I think we can get anyone who wants to get a vaccine today, who is homeless, access to a vaccine, but it sounds as though from the surveys that I'm hearing reported, vaccine confidence is somewhere around 30% amongst the PADS population. So it's clear that we have a lot of work to do in terms of answering people's questions and building confidence in vaccination as a choice. Recognizing that we only have a few minutes left, I wonder, because this is an area of critical concern for many, and I know that the health department and others have been working diligently on it. Are there any updates that could be shared in regards to efforts for the Homebound, where we are and when we anticipate that we'll be able to be visiting individuals at home that don't have another way to get to vaccine?
Sure, I can start, and if Chris is still on, hopefully he can round it out a little bit too. But we've been working with providers, trying to assess willingness and capacity of providers to deliver that type of service. As everyone might imagine, it's more complex than doing it in a lot of other settings. Certainly the advent of finally getting some local supply of the Johnson & Johnson vaccine, which I probably should have mentioned was also important for connecting with individuals experiencing homelessness as well, actually. But it's certainly very useful when we're talking about being active in delivering vaccine for homebound individuals as well. So that has helped, and I think we're very close with a couple different providers. The health department directly with some of our resources, as most of you know, we're primarily focused on operating this big community vaccination clinic here that's sort of a high volume on-site endeavor. But we have just this week started our first round of vaccinations for those that are needing it to be delivered to their home. So I think we did 5 individuals on Wednesday, and that was our first round. And we're going to look to do a couple more rounds next week. We're sort of dipping our toe in the water, right, and making sure that we've got confidence in our ability to do it and the resources to do it. And while we grow that very slowly, as I mentioned, working with other providers who maybe have more experience in that space, delivering that type of care, and can maybe do a little bit more volume than we can. And I think that is where, Chris, I might kind of tee you up for talking a little bit about the partnership with the EMS in the region.
Yeah, for sure. So yeah, through the health department, we're working with the 3 EMS systems that serve DuPage County.
You're hard to hear, Chris.
Okay. Is that better?
Yeah, good, thanks.
Sorry, thanks. Yes, so through the health department, we're working with the 3 EMS systems that cover DuPage County, based at Advocate Good Samaritan Hospital, Edward Hospital, and Central DuPage Hospital. Those EMS systems then work with every fire department across the county. The medical directors for those systems have put together a plan to allow paramedics to administer vaccines at home, in addition to other settings. So we've been working with them to get that approved by IDPH. It is our goal then to be able to work with those departments to get vaccine to individuals in and around their communities. Again, it's low volume because of the time. The vials can have to be used within 6 hours from the time that they're opened. So each vial of 5 doses of Johnson & Johnson, have to be used in that 6-hour time frame. We got to group people in very close proximity to each other and then work with those fire departments to get out. But we are excited. There are many departments across DuPage that have expressed interest in that. We want to be able to work with them. They certainly have resources in the community. They're interested. They may know those patients. They may be there for calls. So that's one more option to get vaccine out to the homebound population, because we know it's going to be time and resource intensive, but we need to get to those folks as quickly as we're able.
Thank you very much. Cognizant that there's a lot of other items that we want to make sure we talk about, and honestly that this is a good segue to another population that we want to talk more about, which is essential workers. I think that what we can commit to is that as we continue forward on these meetings, we'll make space on our agenda whenever appropriate and possible to keep people updated, and also to solicit feedback about the success and continued barriers that we're experiencing with some of those populations that may be smaller in number, but have very significant challenges toward vaccination. With that in mind, I think that we will turn this conversation over and ask Mila to help to lead us through a conversation around vaccine education and access for essential workers.
Thank you, Kara. Go ahead, Dave.
No, good, please.
Okay, thanks. I think it is a good segue because a lot of the folks that we talked about in some of the immigrant populations do also fit into the essential worker categories and have definitely barriers and access issues that we are trying to address. So today, to start the conversation about the essential worker category, we're going to think about strategies to promote vaccine confidence. And I've reached out to the National Safety Council, who is putting together some content they can share with us on what they've been providing to their manufacturing and transportation members on vaccine confidence. And they're thinking about how they can share that with us and how we might use it. And also they're looking at their membership to see what their DuPage County members look like, and if there's any good examples being done here in DuPage that we can learn from. So I'm hoping to have more information from them in the coming 2 weeks and being able to bring that back to you. But additionally, I wanted to invite Glee from Navistar to talk a little bit about their efforts on vaccine confidence and sort of bringing vaccine to Navistar employees. And Glee, if you're able to join us and talk a little bit about what you've been doing at Navistar, that'd be really helpful.
Hello, everyone. David, I'm sorry, I tried to turn on my video, but it's not working right now.
Oh, thank you. Appreciate that.
But the best I can do is show you the really nice picture where at this time, probably most of us would like to be at that beach.
Your call has been forwarded to.
Right. Anyway, I also have Brian Delphi. He's like now my partner with Leon, retiring as of today. Brian Delphi is going to be my partner in this endeavor. As of this, actually early this week, just like last Monday.
How are you?
I'm fine.
Hey, Karen. There we go.
Yes.
Go ahead, Glenn.
As of last Monday, we sent out a survey just to gauge, what's the interest level of our employees. And we have it probably reached out to about close to maybe 28 or 2,900 employees. And the only question that we ask really is whether or not they would be interested to sign up if a vaccine is offered at our facility. And granting that we just did this last Monday, and it was closed at the end of, I believe, was it today, Brian? Or the response was pretty good. We had about 30 respondents, and out of those is like half and half. We were not asking if they have already gotten their vaccines, maybe first dose. All we ask is whether or not they would be interested. And we had about 650 people that they said that they're interested, and about 600 72 that says no, but it does not necessarily mean, that they're not interested in getting the vaccine, and the others, just like 10 of them, which is negligible. But this week will be the first time or next week will be the first time that we're doing our on-site COVID vaccination. So we should be able to report to you back, what would be the response and, from the employees.
Thank you, Glee. I think it is helpful to have some idea from especially a larger employer on how the response has been. And as you move forward with your efforts, if you're seeing any gaps in frontline workers or folks that have hesitancy, and if we can address that.
Yeah, definitely. I will, give you some report as, time goes on, and we can certainly share it with you.
Thank you. And I wanted to point out Navistar because they're a larger employer, and they have Lee, and they had Glee, and they had Leon and Brian. They've got lots of folks that are jumping on this issue and helping bring vaccine to them, which is wonderful. But I think when I talk to smaller employers that have frontline workers that have been working through this entire COVID pandemic, they have hesitancy among some of their employees, and they have access issues with shift work and getting to different clinics. And then they also have, it's almost the opposite of vaccine confidence. They actually have confidence that they've been working this entire time and have been able to do that successfully and not get a vaccine. And maybe in some cases either have gotten COVID and gotten through it, or have not gotten COVID and they've managed and need a little more education on why vaccination is important for them and their families. So we are going to bring some more smaller employers into this picture and talk about that a little bit more. And I just wanted to point out that there seems to be quite a bit of work going on with large employers, and even to the effect of surveying and bringing vaccine on site. The other person I wanted to give a chance to speak was Evan Summers from Bensonville, because he's been doing a lot to identify manufacturing businesses in Bensonville that are still looking to vaccinate their frontline workers. Evan, if you're on and can speak to those efforts.
I am. Thanks, Mila. So I'll be brief, but Bensonville's been very fortunate that as of next week, we'll have delivered 10,000 shots into arms, mostly into our community. What we haven't really focused on is our large industrial district on the north side of town. So this week I started working at that, and I was pretty shocked to find out how few workplaces have been vaccinated and the way they're going about it. Some of our larger manufacturers up there, they work on 3 shifts. They are very concerned about having a single mass vax event because they're afraid that by the second dose, they're going to have high unemployment because people will call off work because they're feeling ill. So these are some of the challenges that we're working through. I appreciate the health department brainstorming with me ways that we can get these people vaccinated. But generally speaking, the owners of these companies are saying to their employees, figure it out on your own. I don't know how to get you vaccine, so you have to figure it out on your own. We'll give you a sick day if you go get a shot. And that's with where we're at. So while I've been very successful down here getting my residents vaccinated, I'm seeing the opposite story up on the north side of town. One of the other areas that we have is a lot of temporary job placement agencies are essentially what I think is a way that companies are getting around immigration status and hiring immigrants or undocumented individuals. So these are at-risk people working in the front lines, working the assembly lines that really aren't necessarily employees of the manufacturer itself. So we're going to need to break into that and figure out how we can get those undocumented individuals vaccinated.
And Evan, that last issue you brought up, that actually came up through Reverend Miguel when we were talking about how to, the relationship between an employer and an employee. Some employers, especially if they're not very large or they don't offer health insurance, they're not in the habit of providing information, health information. They don't have a process to do that. They may not have that kind of relationship with their employee. And Reverend Miguel had brought up that there's a large, group of people that are working in an agency type relationship, that their relationship is with the agency, not with the employer. So yeah, that's an important thing to be aware of. We are going to sort of pilot with one of the local grocery stores, dropping off some bilingual information about vaccine and leaving that in the break rooms, and then trying to offer some more appointments to that same group in about a week, and see if we get a better uptake from those folks. But we're open to piloting some different things with those agencies, if you think that'd be effective.
I absolutely think it would be. I think one of the challenges there that it's on me to figure out is I don't communicate with those agencies on a regular basis as a village manager. I communicate with the businesses themselves. So I'm going to have some introductions made and meet some new friends.
Thank you, Evan. Chris, did you want to jump in with an update?
Yeah, just one other update on essential workers. One other group that we've worked with, they've done some direct coordination with the state, but the Valley Industrial Association works with a number of manufacturing and industrial organizations across DuPage and Kane. And over the past 2 weeks, and then a couple events coming up in the next few weeks, they've done a few thousand workers from different manufacturing and industrial organizations across DuPage and Kane. And they've really helped to organize the work across the different employers, trying to take some of the load off them, figuring out and saying, if you send us your 50 people at this time, we'll work you in. So Kathy Gilmore is the executive director of that association. She's really done a tremendous job organizing with those employers, with the state. Jewel has been really helpful in getting some staff down there to help fill in, but the state is supporting that through some efforts. So we'll work to connect some other groups to that, but that's a few thousand individuals in that industry and essential workers that have been vaccinated or will be in the next few weeks.
Chris, just a comment. I'm recalling that Greg Bedeloff had told me not so many months ago that actually while we were working on the flu vaccine project, that he did have a list of contacts representing, I think, hundreds of local restaurants. And this is another one of those categories where you have individuals who qualify. The organization in many cases is too small to be an appropriate host site for vaccine at this stage in our development. And yet these are folks that are at very high risk. I wonder if, similar to what you're describing, Greg might be in a position to help us do some organizing around supports for that population as well.
Yeah, that'd be a fantastic group to work with, both Greg, and if anybody else has really good connections to a group that might help organize across those different, either the employees or the employers, we'd be happy to work with them, because that's another critical population, especially as things are opening up and people are at, in higher risk environments. We would love to get them vaccinated.
I ask a quick policy question? So once the vaccine floodgates open, so to speak, or people eligible to be vaccinated open, will the county continue to prioritize groups, or is it going to be everyone on an equal playing field?
Yeah, Adam, do you want to take that one?
Sure. Yeah. So fortunately, I think we had a little bit of foresight that this could be an issue where there would be lots of people waiting because the supply was never meeting the demand, and then eligibility would open up, right? And this question of eligibility versus access has sort of plagued us throughout. So one of the things we did, and some folks might remember, was we upgraded our registration system about a month ago. And this was one of those reasons, so that the system that we now have allows us, at least for our site and what we're able to control, that we target the appointments, who we offer it to. It's not like an open access link that where people can kind of, rush that. So we will continue to prioritize, 1A, 1B, 1B plus, those groups that have been waiting the longest, have not had access. They will get invitations to schedule on our scheduling calendar and for our site prior to all these folks that are just becoming newly eligible starting Monday, right? So we certainly welcome the newly eligible to register, but yes, the county will prioritize scheduling and access to the groups that are in the higher risk for exposure or severe health outcomes primarily. I guess I would add, the other thing we have done and we can continue to do is we can reserve some percentage of a small, but some percentage of what we have available here for working with groups. We've piloted this a few times, I think, with a few groups connected to Heart. I think, you know, we learn lessons along the way, and that's a good thing, and we want to continue doing that. Kara's been a great partner in that and getting some of those folks, but I know that we've had at least a couple, I mean, they might have been smaller groups with St. Mark's Church, the AME Church. You know, we're happy to continue doing things like that and refine that approach a little bit each time as well. So kind of on two levels, right? Like our normal scheduling that goes to individuals, still prioritizing the individuals who signed up and enter those eligible groups. And then we can do another pathway that is kind of coordinating with you guys who can maybe mobilize your stakeholders and coordinate with us to get them over here. I hope that answers it. And if there's other questions, I'm happy.
And I'm noticing as we're, we're moving kind of through and maybe 3 agenda items at one time with this part, but let me just note, Cristobal, you're mentioning that Immigrant Solidarity DuPage, a big part of your constituency are from temp agencies. And we've heard stories here today about places where industries are having success. I want to ask the group, do we want to have another conversation focusing especially on this group? Mila, I wonder from your perspective, what's the best next step?
I think today, this is sort of the teaser to see, you know, where some of the folks are at. And it looks like we have a lot more we can do here. I'd like to, you know, schedule something out, and I think I can do some pre-work, and you guys who are on this call can reach out to me or to any of us that are, you know, here at the health department doing this work, and we can talk about how to bring more access, and then more structure maybe, so that people can understand where to find the resources. I want to add one more thing though, Dave. I don't know if Jenny Fabian is on this call from PRC, but she made a really good suggestion that we're working on, and that was to put the information on the postcard about how to reach out to the call center and register. And then, you know, also some of the other regional mass vac sites in the area, to put that on one sheet in 5 languages. And she chose the 5 languages that are most, you know, popular at the food pantry, but I imagine we would cover quite a few of our, you know, the folks we were talking about in item number 3 and right now, and we could give that same information to those businesses, small and large. Because I'm hearing Evan say that employers are telling people, we don't know how to help you with this, you need to figure it out. And there's a lot of language barriers that are existing. So that's one thing that we're currently working on and hoping to have that available next week. We were in a situation where we didn't want to put it out right before the eligibility changed, because, you know, it's just easier to wait until after April 12th. You don't have to work through all those criteria. So that's a little bit of what I'm thinking, Dave.
One postcard, many languages, multiple sector outlets. It's fantastic. Very good.
I want to share also, Jenny had another suggestion that I also thought was great. So we really do need to get Jenny here because she's got all the good ideas. She also reached out to me earlier this week, and we're going to talk a little bit more about the idea of taking some of the pandemic health navigators that are out in the community, and a lot of the food insecurity providers struggle because they don't have bandwidth to be able to screen and support each of the clients that come to them for food distribution on connecting to vaccine. But they very much want to be a part of that process, and they recognize that there's a lot of synergy in engaging with the clients with whom they're working. So her suggestion was, would we be able to come with an iPad, and after someone had picked up their food, without them ever having to get out of the car, to be able to have some conversation if they were interested and willing to be able to schedule them for vaccine. If they were not, to be able to give them some information and create some pathways so that we could follow up and investigate some of their hesitancy a little bit further, which I thought was a great idea and one that I'd love to explore a little bit further.
Very cool. Thanks, Kara. And I'm feeling a need. We're at 2:30. We know we want to close by 3, and we're getting ready to move into the DuPage County COVID-19 vaccination update. And I'm aware as we move into this that this is been a subject, a rich subject for us for much discussion. So I'm just going to be cautious as we go through this to make sure that we stay, that we allow Chris to get through the data parts and then move perhaps to questions, unless they're brief questions on the way through. Although I don't know what Chris is providing today, every one of these over the past 3 or 4 months has been full of incredibly good information. So I want to make sure he can get through that.
Yeah, thanks, David. I will hit some highlights, and then we'll put the link to all of the slides in the chat so you have time to dig into it, because there is a lot of rich information here. But I'll try to just hit some highlights so we have time for questions and other material. Dave, are you seeing a full screen or a presenter view?
Presenter.
Okay, cool. All right, hi everybody, it's Chris Hoff from DuPage County Health Department. Thanks for the chance to give a quick update. We want to temper our enthusiasm about vaccine and how well it is going in terms of getting people vaccinated, with the idea that positivity and cases are going the wrong direction right now. So as focused as we have been on increasing the number of vaccines going out, all the more reason to get vaccine to people that have not had the opportunity yet, because we're seeing a steady march upwards in terms of our positivity and cases. Our positivity have been as low as in the 3% as of the end of February. And our most recent data has us close to 7% at 6.7%. So not an increase we want to see, not what we were hoping to see after bottoming out so low and getting so many vaccines distributed. Cases too have steadily climbed up. We were at a very low point of 118 new cases per day back on March 12th. As of April 7th, we were back up over 245 new cases per day. Those are all people that are possibly infectious and out in our communities. So really the need to maintain all of the things we know are working: wearing masks, keeping distance, gathering outside when we can, keeping group sizes small, are so important as we work to get vaccine out to all of our community. The groups really driving the increases right now are the 20 to 39-year-old group and the 40 to 59 group. Big increases, over 50% in the last 2 weeks. So these are really the groups that we need to help stay safe, right? So take good preventive measures now and get them vaccinated as quickly as we can, especially the older groups that we know are at higher risk, or people with underlying conditions that may be at higher risk for these severe outcomes. The good news is that we have a lot of people who have had at least some vaccine. So as of today, over 345,000 DuPage County residents have received at least 1 dose, and over 200,000 are now fully vaccinated. That's an incredible number of people, but we still have a long way to go. Our over 18 population in DuPage is over 700,000. So as we feel some excitement and enthusiasm about the number of people who've been vaccinated, there's still hundreds of thousands of people that have not had the opportunity to be vaccinated yet here in DuPage. Some are choosing not to, some are still waiting. And so we have to be cognizant of the fact that as well as we're doing, there's still a lot of people out there who are susceptible to COVID based on their vaccine status. This week, just to help you all, because I think one of the things we hear most from people is, we need to move faster. Can't we get more people in? Why is it taking so long? This week, we're receiving 19,000 doses for all of DuPage County. So for the 1 million people here in DuPage, we have 19,000 first doses to administer at the health department community vaccination site and through other providers, the hospitals, independent pharmacies, medical offices, federally qualified health centers. Now, some of these providers are getting some supply from the state and federal government. 2 weeks ago, that was about 10,000 additional doses in the county, but it's not a huge number. And so we really are trying to move as fast as we can with the vaccine we're getting. Next week, we're projecting we know now that we'll have 20,000 first doses next week. Unfortunately, the next 2 weeks after that don't look great. IDPH is telling us we can expect about 18,000 doses the following week, and then 10,000 the week of April 26th. So we're not seeing that explosive tsunami of vaccine that's going to be pouring into our communities. We're really working with IDPH to try to get some more vaccine here, especially as our positivity goes up and our demand for vaccine remains high, but we're not seeing an exponential increase in the amount of vaccine that's available. At the bottom bullet there, we are opening with the state to allow anybody over 16 to register for vaccine. We want to get them in line, get them ready, make sure that as we have vaccine, we're able to get to those folks quickly but we will continue to focus on those high priority groups that Adam talked about. You can see on the right side of this chart, the orange line in that chart is the 7-day rolling average of vaccines administered per day. So right now we're about 10,000 doses being administered every day. It's a combination of first and second doses. That number has increased dramatically, but it can only go as high as the amount of vaccine we have. So all of our providers are working as quickly as they can to get vaccine out. And as much vaccine as we have, we're going to be pushing to the community. DuPage has continued to lead the way around Chicago metropolitan area. In terms of the population fully vaccinated, look at the far right column there. We're over 22% of our population has been fully vaccinated at this point. That's great in the Chicago metro area. That's of course due to getting vaccines administered quickly and getting people back in quickly for those second doses. But we are seeing counties downstate in Illinois pushing 30% of their population fully vaccinated. The Tribune this weekend had a big article Sunday morning about the tourism boom in Quincy because they've got more vaccine than they know what to do with, and people are driving down there. We really want to make sure that vaccines are available to people here, especially to those that can't hop in the car and take an 8-hour journey to Quincy. So any opportunity you have to advocate for more vaccine to the metropolitan area, especially DuPage, please do so. We're working our state legislators, the state agency contacts, but they can't just hear from us. They need to hear from you all too. Dr. Chug and her team have been working very closely with the state to get access to better information about who's being vaccinated. Of course, we want to evaluate how we're doing and make sure that our populations are being vaccinated, at least at the level of the population they represent. The data quality has been getting better over time. And the number of unknown records are improving, but we still have some work to do to make sure that our populations who are being vaccinated reflect the makeup of our county. Dr. Chug, do you want to highlight anything from this slide? Your team has done a lot of work to get access to this data.
Just as you said that we have a lot of room for improvement. And so we continue to strive, collectively here. That's why we're all here. And, but just wanted folks to, realize and appreciate that together we are making incremental progress. So thank you.
Perfect, thanks. And just a note here, the bottom bullet on the left side is where vaccines being administered. So just kind of a note if you're curious where these vaccines are generally being administered. Pharmacies are leading the way, followed by hospital, clinics, the health department, and then federally qualified health centers are the primary sources of vaccine right now. We're trying to push vaccine to as many providers as possible. So wherever people are comfortable, they can get a vaccine. Some really good news in terms of a high risk population, a population that we know experiences severe outcomes related to COVID, are those over 65 years old. As of today, we are at 120,000 exactly, or at least when the data was reported, of people over 65 who'd received at least one dose. That's good for just over 83% of that population in DuPage County. And over 91,000 are fully vaccinated. And that number will, of course, catch up to the at least one dose group over the next few weeks. So really some great focus on this group. As this group gets vaccinated and gets to the highest level that it can be, obviously we need to shift our focus to those other populations that are at high risk as well. DuPage also has done a tremendous job of getting vaccine to that age group, the 65 and up group. Good for second in the state. There's 102 counties in the state. DuPage is number 2 right now in terms of getting vaccine to that age group. And so you can see here the matchup against the other counties. So just want to appreciate the work our providers have done to really make sure that group is protected. As we look at the statewide reopening metrics and we get back to some of the capacity limits increasing and different venues being opened, the state had identified a threshold of 70% of people 65 years and older being vaccinated. We crossed that a few days ago, and we're now at almost 74% of people 65 and older across the state have been vaccinated. Unfortunately, the other metrics that the state has identified as critical to moving forward in our reopening have to do with hospital capacity and the use of healthcare resources. And unfortunately, and really concerning, is that these are not headed in the right direction across the state, nor in DuPage County. And so we really need to help our residents, our partners, our friends, our families stay safe because vaccine is just not yet available to everybody that wants to be vaccinated. So of the 4 metrics the state is monitoring for progress in moving ahead on reopening, ICU bed availability has stayed relatively flat and above the required threshold. But unfortunately, new hospital admissions have gone up dramatically. The number of hospitalized patients every day has increased. And even the daily mortality As of last week, this was trending down. This was decreasing. We were really in a better place. Since then, that line has leveled out and it now looks to be increasing a little bit, but is overall captured as no significant change. So we need that to be going down too, and we're going to be watching those closely. You have the link there to keep track of it yourself too. We continue in DuPage to try to push vaccine and get as many providers registered as possible. The mass vaccination sites are not the only tool, and people, can't all get to those sites. So we continue to try to expand the number of providers available and receiving vaccine. The link on the bottom of this page will take you to our website that's being updated weekly about how much vaccine we're receiving, where it's going in terms of provider type, and the quantity of vaccine we're getting across the 3 different types of vaccine. DuPage does have tremendous capacity to get vaccine out. So as we advocate for more, just know that the capacity is there. We have a lot of organizations offering space or offering to volunteer. Those are all welcome and appreciated. But really the issue right now is we don't have enough vaccine to even meet the needs of our providers that are ready to go today. So we are recommending that people take advantage of sites outside of DuPage. As much as we hate to send people elsewhere, these other state-run sites are getting vaccine, have the capability to see our residents. So if you live in or around these areas, please do refer and make sure that people know these sites are available to them, because we want people to get vaccinated regardless of where they get vaccinated. I talked about our first dose availability, but this just kind of graphically shows you the ups and downs of what we've seen and the projection over the next few weeks that we're actually expecting to see less vaccine than we have in the past few weeks. And so just awareness for you, your partners, your clients, that we're just not seeing that incremental climb for more and more vaccine, and that absolutely limits the amount of people that can be vaccinated every day. A chart on our website breaks down where the vaccine that we do have. So of the 20,000 doses we're getting, where do they go? This breaks down where that vaccine is headed based on the providers who are requesting it from us and where we're trying to fill requests. So just so you know, all of the different provider types that are getting vaccine and will have some availability. In terms of our community vaccination site and the DuPage County vaccine registration list, as Adam said, or Mila, we have over 200,000 people that are still registered looking for vaccine. You can see the breakdown here of who's on that list. So we still have some 1As that are registering. Our people that may not have been wanted vaccine or decided to wait are now seeking vaccine. So we have some folks in 1A, and then about a third of individuals who fit in those other categories. So to Evan's question, we're going to continue to prioritize people that were up early based on their risk and exposure, continue to get them in as we expand to new people who are signing up every day. We were able to negotiate an additional vaccine supply from the state for this site. So we've been able to expand operations to let this site really run at full capacity. So right now, the Fairgrounds Community Vaccination Site is doing about 1,400 doses a day, a little over 8,000 a week. And to date, the health department has administered over 48,000 vaccines. So making good progress in getting people vaccinated, but with 1 million people, we need as much help and as much vaccine as we can possibly get. One additional option that I want to bring to everybody's attention, so this is really important, it's a new slide this week and a new link, I'll put it in the chat, is that IDPH is doing some mobile vaccine equity clinics with a separate vaccine supply and separate providers that they're coming in to do these temporary sites. They've identified this as an opportunity to hit some of the vulnerable populations that may not be able to get to mass vaccination sites, and trying to overcome barriers around language, technology, disability, transportation, the hours these clinics are open. And so there's a link here to request one of these clinics for your organization or for your facility if you want to host that. There's a whole application to fill out that asks you to identify the specific race ethnicity breakdown that you project to see. And then any special population types, and I put the drop down here to highlight what different groups they're looking at. Not every site that applies will get this. We don't really know exactly what criteria they're using, but I would encourage anybody that's interested to use this as a potential option to bring more vaccine to DuPage.
Chris, could Mila email that to everybody, just to make it a little bit easier for some of us who aren't linked between chat and our Outlooks?
Yes, 100%. We've talked about some of these slides before, so I'm going to zip through in the interest of time, Dave. In terms of where we're sending vaccine, we're trying to match vaccine to communities that have higher levels of need based on CDC's Social Vulnerability Index, and assessing where providers are using vaccine, who they're bringing in, and trying to steer vaccine to those areas to make sure we have an equitable distribution, both in geography and population. We've updated the timeline. Of course, everybody's eligible starting next week. And you've got links here to all of our different resources for communication to be able to share out with partners, with clients, anybody else. And that's it, Dave. I want to stop and make sure there's time for questions.
Lightning speed round, Chris. Thank you. I want to let folks know who are on this meeting for the first time that Chris has gone into depth in each one of the areas that you saw him go through so capably and so quickly right now. If you review earlier meetings of this team at the DuPage County Health Department YouTube site, you'll see a lot more depth on some of those issues. And I do want to encourage you. You see there that Chris has provided to us in that PowerPoint a lot of good information about how vaccination and efforts are being targeted to address equity. One of the very best things that we can do is dispel misinformation. So wherever we can take the results of this meeting, that YouTube recording or the PowerPoint that Chris is going to share in the chat, or other elements out to our constituencies so that they know what's going on. They can absorb the information themselves. The more we're doing to dispel the misinformation that so often gets in the way of our achieving the equity goal that we have. So I say, Chris, thank you very much. We're at 13 minutes till 3, and we have a communications subcommittee report to have. And Mila, this is the area that I'm hoping that Reverend Miguel and Sarah would be able to summarize too. Are there any quick, I don't know if there is such a thing, questions in response to Chris's presentation? I don't want to cut off debate. If there are questions, let's take them in. If we can answer them here, we will. If not, we'll follow up with answers to them. All right. Hearing none, Mila, could I invite you back to the mic for
Sure.
Communications Subcommittee?
Thanks, Dave. And for those of you that are new joining us today, we have a communications subcommittee that meets in between these larger group meetings to work a little closer on the PSA project and the health ambassador work that we're looking to start. In addition to collaborating on events, I have a note on this agenda that there's a Spanish town hall that is being developed with DuPage Health Coalition kind of taking the lead, and Karen Murphy will continue to give us updates on that. But regarding the Health Ambassador project, I wanted to ask Nicole Edmonds from Advocate Aurora Health to jump in and provide us an update on that effort.
Sure, thanks, Mila. So I think the last meeting I actually kind of went over what the vaccine ambassador program is. So Advocate Aurora Health is calling it the Neighbor to Neighbor Vaccine Champion Program. And so we met with our Community Outreach Advisory Council, who we specifically we put that group together to provide feedback on the content of the training. We wanted to make sure it was culturally and community culturally relevant, and also it was kind of relatable to the individuals that we are trying to train. A very grassroots approach to this training. Literally can be anyone from individuals that work with community organizations to community leaders to community residents and community organizers. And so we had our first meeting with the Community Outreach Advisory Committee yesterday. We went through all of the content with the Vaccine Champion training program, and they gave us some feedback. They gave us some really great feedback. We're actually working on solidifying the modifications today based upon the feedback that we received from that group. And again, that group is kind of comprised of various community organizations representing diverse races and ethnicities and age groups across Wisconsin and Illinois. So we're working on kind of modifying some of the content and the registration process based upon that feedback from that committee yesterday. We're looking to have our first training April the 20th. We're gonna, based upon feedback, we really heard that initially we planned for training from 3 to 4 p.m. But because we're really looking to train kind of very grassroots, have that grassroots approach where we're looking to train individuals, community residents, and leaders, we got a lot of feedback that a lot of individuals worked during that time. So we're gonna actually host 2 trainings on April the 20th. One will be from 3 to 4. The other training will be from 6 to 7. We're also going to do a training in Spanish, tentatively April the 22nd, same time. So April the 22nd, 3 to 4, and then again from 6 to 7. The content, one of the feedback that we got from the committee was to make sure that we have an adequate amount of time allotted towards questions and answers. So we will have a physician and a clinical expert spin on these trainings, on all of those trainings, to be able to answer clinical questions around the vaccination. So maybe I can work with Mila to send out that link if anyone is interested in registering. I think we're working, Mila, together to kind of figure out the plan if we want to do kind of like a specific training to the Heart Group or DuPage County. But either way, I can send out the link for those 2 dates, so the April 20th trainings and also the April 22nd training, in case anyone is interested and available to attend.
Thank you, Nicole. And I just wanted to share that Nicole and her team has been really generous with offering us the opportunity to have folks from heart organizations sit in on those trainings, and then even a step further, think about how they could support us with a DuPage specific training that would give us the opportunity to fine tune the vaccine questions and access points that we need to have specific to DuPage. So I think she really laid out nicely the time frame that they're looking at with April 20th, and actually it's even a little more than what she and I had talked about, with a Spanish speaking opportunity on the 22nd. So you'll receive from Nicole and I some follow-up steps on this, and we just wanted to keep you apprised of where we're going. So thank you so much to Advocate and Aurora Health for that. It's a wonderful partnership. Related to the PSA project and the Ad Council campaigns, the Health Department has been working hard on the PSA project with the input of the Communications Subcommittee and lots of folks throughout DuPage that are interested in championing vaccine confidence. So if you have seen our Facebook page, you'll have seen some Ad Council campaigns that aired this week, because those are really excellent campaigns that are focused on vaccine confidence for communities that are disproportionately impacted by COVID-19. And then you would have seen the Orbert Davis PSA that he made specifically for Heart, with the prompting of member Lynn LaPlante, who was so generous with her contacts. And then as the next couple weeks unfold, you're going to see PSAs that will reflect all of our different communities in DuPage with tailored messages, not only from the person who's providing that message, that it's authentic to them and the target audience that they're trying to reach out to, but also that we have received lots of good input from the Communications Subcommittee and have been informed by lots of national campaigns on how those messages are best received. So good stuff coming out of that that committee. One thing that we didn't get to today is a further update on the survey that Mimi Zhao and lots of our folks have been working hard on sharing the outcomes of that with you. And that was intentional so that we could come back to you with some very specific next steps on how that survey outcome data could be used to target messaging and education based on what we learned. So Mimi's really been digging through that, and the subcommittee is taking time to have discussions, really important discussions on who we missed, why we missed them, and how we can maybe still learn more through focus groups and some other opportunities. And then lastly on here, I have the Spanish Town Hall, which I think, Kara, if you want to give a brief update about that, or we could send that in an email if that's more appropriate.
I can do it in 30 seconds. It's really fast and good. So the only thing that we were waiting for was actually a moderator. We had all of the speakers for the event, and I was really excited. And in fact, she's on the call today, that Gabby has offered herself up to be the moderator for the event. So after this call ends, I'll be sending out a scheduling link to all of our presenters so that we can find the best date over the weekend to be able to host the event towards the end of April. What we're also hoping to be able to do, I'm still working through these details, is I would love to be able to have a vaccination event that follows within 24 to 48 hours that Spanish language town hall, so that individuals that listened to that town hall and were then inspired to wish to sign up for vaccine, we would be able to offer them spots for an event that happens shortly thereafter. So that's sort of a piece of what we're hoping to be able to accomplish as well.
Thank you, Kara. So Dave, I think that kind of wraps up. So if we have time for Reverend Miguel and Sarah to give a minute or two of feedback, I'm happy to turn it over.
Thanks, Mila. That was kind of the perfect cue up. Kara is anticipating that there's going to be a vaccination event, and we have two members on the call today who've gone through that experience. And I wonder if we could ask you to recap briefly the lessons learned there. Reverend Miguel and Sarah, would you be willing to do that?
Sure, we'll take a minute. Thank you for the opportunity. Again, and during this process, we are a great opportunity to learn and understand, especially the Latino community, what is the barrier that we face it and to get the vaccines, you know, and we able to share and discuss during these meetings all these observations and experience coming from the people who's getting the shot. And it's giving a better understanding, you know, how we can respond in the middle of the situations. So I'm encouraged to continue, you know, because this is a great opportunity, and everyone is very open, you know, to sharing and here. So this is something great. Yeah, thank you.
Thanks.
And just following that, you know, we really want to thank the county health department for allowing people made visible and our partners in West Chicago to self-schedule some people, which helped us with the vaccine hesitancy and those people who had issues actually accessing the portal. I will just throw out, and something that I've talked to Mila with and I know is being worked on, is the issue of IDs and the variety of IDs that people will bring to a vaccination site. And making sure that volunteers or other staff that's checking in can be as flexible as possible with that. Because we are hearing that some people had a bad experience at the first time and then are hesitant to return on the second one to get their second vaccine. And unfortunately, the new data about Pfizer being 80% good on the first then makes people think, well, do I really need a second? So we really want to make sure that that doesn't happen and we don't lose those people in the midst of what an experience might be like to them, and or then spread the word to anyone who's already nervous based on their immigration status to have an issue going forward. I definitely think though working with the community partners is a good way to get around that. And we've got another couple community-based vaccine clinics since then that's helped spread the word that no, this can be easy and we just have to trust the system. And then for people who are very hesitant, we've actually had some of our volunteers on site to make sure that there is someone they know who is greeting them, even at some of the larger clinics.
Sarah, thank you very much. Really helpful. So that's a great way for us to come to a close. We're 1 minute until 3 o'clock. A big thank you to all of you for offering up your voices and your input today. And, you know, a special thank you to Nicole, to Adam, to Chris, Evan, Glee, Mila, and Kara for having presentation material for us to work with and for being open to feedback coming in your direction. To all of you for the work that you're doing, you're persevering at. As I look at your eyes at 3 o'clock on a Friday afternoon, I see a lot of weariness, and that makes me appreciate you all the more for being here and for what you're doing. So we will come back together in 3 weeks, and I wish you all a good experience and good health until then. See you then.
Thank you.
Thanks. Bye.
Bye-bye, everyone.